Question 1. A nurse is prioritizing care for 4 patients. Which patient with COVID-19 symptoms should be assessed first? A. A patient with a fever of 101 degrees Fahrenheit and dry cough. B. A patient reporting anosmia and mild sore throat. C. A patient with a respiratory rate of 32 and use of accessory muscles. D. A patient with fatigue and myalgia. Answer. C. A patient with a respiratory rate of 32 and use of accessory muscles. Question 2. Which task is most appropriate for a nurse to delegate to an unlicensed assistive personnel, UAP, in the care of a COVID-19 positive patient? A. Administering 4 medications. B. Assessing oxygen saturation changes. C. Assisting the patient with oral hygiene. D. Interpreting lab values. Answer. C. Assisting the patient with oral hygiene. Question 3. Which infection control action should a nurse take when entering the room of a patient with suspected COVID-19? A. Wear surgical mask only. B. Wear N95 respirator, gown, gloves, and face shield. C. Wear gloves and surgical mask only. D. Wear face shield and gloves. Answer. B. Wear N95 respirator, gown, gloves, and face shield. Question 4. A nurse is caring for a COVID-19 patient with worsening hypoxia. Which provider order should the nurse question? A. Titrate oxygen to keep SpO2 greater than 94%. B. Administer albuterol via nebulizer every 4 hours. C. Encourage incentive spirometry every 2 hours. D. Monitor arterial blood gases. Answer. B. Administer albuterol via nebulizer every 4 hours. Question 5. A nurse on a COVID-19 unit is making assignments. Which patient is best assigned to an LPN? A. A patient requiring 4 push medications. B. A patient needing initial assessment after transfer. C. A patient requiring education about discharge precautions. D. A stable patient requiring routine oral medications and vital signs monitoring. Answer. D. A stable patient requiring routine oral medications and vital signs monitoring. Question 6. Which finding in a COVID-19 patient indicates a need for immediate intervention? A. Pulse oximeter reading of 88% on room air. B. Temperature of 100.4 degrees Fahrenheit. C. Mild shortness of breath with activity. D. Anosmia for 2 days. Answer. A. Pulse oximeter reading of 88% on room air. Question 7. A nurse is educating a COVID-19 patient on home isolation. Which statement indicates understanding? A. I will leave the house only for groceries. B. I can stay in the same room with my family. C. I will wear a mask when others are in the room. D. I don't need to disinfect surfaces daily. Answer. C. I will wear a mask when others are in the room. Question 8. Which intervention should be prioritized for a COVID-19 patient with respiratory distress? A. Encourage oral fluids. B. Elevate head of bed to 90 degrees. C. Administer stool softener. D. Offer warm tea. Answer. B. Elevate head of bed to 90 degrees. Question 9. A nurse is precepting a student nurse on a COVID-19 unit. Which action by the student requires intervention? A. Removing N95 mask after exiting patient room. B. Wearing gloves when handling patient belongings. C. Using hand sanitizer after removing gloves. D. Wearing isolation gown in hallways. Answer. D. Wearing isolation gown in hallways. Question 10. What is the most appropriate nursing action when a COVID-19 patient reports chest tightness and severe dyspnea? A. Encourage pursed lip breathing. B. Reassure and recheck in 15 minutes. C. Call rapid response team. D. Place in Trendelenburg position. Answer: C. Call rapid response team. Question 11. Which COVID-19 patient should the nurse assess first after shift handoff? A. Patient receiving convalescent plasma infusion. B. Patient with increasing confusion and low-grade fever. C. Patient on nasal cannula reporting fatigue. D. Patient eating breakfast and watching TV. Answer: B. Patient with increasing confusion and low-grade fever. Question 12. A nurse delegates vital signs for a COVID-19 patient to a UAP. What instruction is most important? A. Report if the patient refuses. B. Tell me if the patient has a fever. C. Report if oxygen saturation drops below 92%. D. Record readings in the chart. Answer: C. Report if oxygen saturation drops below 92%. Question 13. A nurse is reviewing lab results for a COVID-19 patient. Which finding requires immediate provider notification? A. Lymphocyte count of 800/mm superscript 3. B. Potassium of 4.1 milliequivalent/L. C. D-dimer of 1.2 μg/ml. D. WBC of 6,000/mm superscript 3. Answer: C. D-dimer of 1.2 μg/ml. Question 14. Which action should a nurse take first when a COVID-19 patient's oxygen saturation drops to 85%? A. Increase oxygen flow rate. B. Call the healthcare provider. C. Recheck saturation with another pulse oximeter. D. Apply a non-rebreather mask. Answer: D. Apply a non-rebreather mask. Question 15. A COVID-19 patient is scheduled for prone positioning. What is the priority assessment before the procedure? A. Recent bowel movement. B. Skin integrity on the back. C. Oxygen saturation and hemodynamic stability. D. For psych condition. Answer: C. Oxygen saturation and hemodynamic stability. Question 16. A nurse observes a UAP entering a COVID-19 patient's room without eye protection. What should the nurse do first? A. Document the incident. B. Report to the charge nurse. C. Instruct the UAP to leave and don proper PPE. D. Provide training later. Answer: C. Instruct the UAP to leave and don proper PPE. Question 17. A nurse prepares to discharge a COVID-19 patient. Which instruction is most critical? A. Continue antibiotics until finished. B. Resume daily activities tomorrow. C. Avoid close contact until at least 10 days have passed since symptom onset. D. Drink at least 1 liter of water daily. Answer: C. Avoid close contact until at least 10 days have passed since symptom onset. Question 18. A COVID-19 patient reports leg pain and swelling. Which action should the nurse take first? A. Massage the leg to reduce discomfort. B. Elevate the leg above heart level. C. Notify the provider immediately. D. Apply a warm compress. Answer: C. Notify the provider immediately. Question 19. A nurse notices a rise in COVID-19 cases among staff. Which action is a priority for reducing transmission? A. Limit staff breaks. B. Reassign staff to non-COVID areas. C. Reinforce hand hygiene and PPE use. D. Cancel elective procedures. Answer: C. Reinforce hand hygiene and PPE use. Question 20. A COVID-19 patient has been on high-flow nasal cannula for 6 hours and shows worsening signs. What should the nurse anticipate next? A. Discontinuation of oxygen therapy. B. Transition to non-invasive ventilation. C. Begin oral hydration therapy. D. Administer antipyretics. Answer: B. Transition to non-invasive ventilation. Question 21. A nurse notices a COVID-19 patient is confused and restless. What should the nurse assess first? A. Blood glucose level. B. Recent medication administration. C. Oxygen saturation level. D. Pupil response. Answer. C. Oxygen saturation level. Question 22. Which task should not be delegated to a UAP caring for a COVID-19 patient? A. Assisting with feeding. B. Taking vital signs. C. Providing the bed bath. D. Evaluating oxygen therapy effectiveness. Answer. D. Evaluating oxygen therapy effectiveness. Question 23. A nurse is teaching about COVID-19 vaccination. Which statement indicates a need for further teaching? A. I will still wear a mask in public places. B. I don't need a booster if I had COVID-19. C. I may experience mild side effects after vaccination. D. The vaccine helps reduce severe illness risk. Answer. B. I don't need a booster if I had COVID-19. Question 24. A nurse is caring for a COVID-19 patient who suddenly develops slurred speech. What is the priority action? A. Increase for fluids. B. Check blood pressure. C. Initiate stroke protocol. D. Ask about recent food intake. Answer. C. Initiate stroke protocol. Question 25. What is the nurse's priority when preparing to transfer a COVID-19 patient to another unit? A. Administering routine medications. B. Alerting the receiving unit of the infection status. C. Obtaining discharge instructions. D. Providing discharge education. Answer. B. Alerting the receiving unit of the infection status. Question 26. Which PPE is unnecessary when caring for a COVID-19 patient under airborne precautions? A. Gloves. B. Surgical mask. C. Gown. D. Eye protection. Answer. B. Surgical mask. Question 27. A COVID-19 patient receiving anticoagulation therapy has hematuria. What is the nurse's priority action? A. Document the finding. B. Notify the provider immediately. C. Encourage increased fluid intake. D. Recheck vital signs in 2 hours. Answer. B. Notify the provider immediately. Question 28. Which COVID-19 patient should the nurse visit first? A. Patient with mild shortness of breath. B. Patient reporting increasing chest pain. C. Patient requesting a blanket. D. Patient asking about discharge date. Answer. B. Patient reporting increasing chest pain. Question 29. A nurse is caring for a COVID-19 patient who is anxious and tachypneic. What is the most appropriate action? A. Encourage deep breathing exercises. B. Turn off the lights and leave the room. C. Increase for fluid rate. D. Administer anti-anxiety medication without a provider's order. Answer. A. Encourage deep breathing exercises. Question 30. A nurse is providing end-of-life care for a COVID-19 patient. What is the priority nursing intervention? A. Encourage patient to eat. B. Offer spiritual support and comfort. C. Teach deep breathing techniques. D. Monitor for fever. Answer. B. Offer spiritual support and comfort. Question 31. What should a nurse do after removing PPE when exiting a COVID-19 patient's room? A. Perform hand hygiene immediately. B. Discard used PPE in hallway trash. C. Touch ID badge to check notifications. D. Put on a surgical mask over N95. Answer. A. Perform hand hygiene immediately. Question 32. Which lab result is most concerning in a COVID-19 patient receiving corticosteroids? A. Glucose of 140 milligrams per deciliter. B. Potassium of 2.8 milliequivalent/L. C. Sodium of 136 milliequivalent/L. D. WBC of 8,000/mm superscript 3. Answer: B. Potassium of 2.8 milliequivalent/L. Question 33. A COVID-19 patient is becoming increasingly fatigued during meals. What is the most appropriate action? A. Encourage completion of meals quickly. B. Notify dietitian for feeding tube placement. C. Provide small frequent meals and rest periods. D. Stop meals until appetite improves. Answer: C. Provide small frequent meals and rest periods. Question 34. Which statement by a new nurse regarding COVID-19 transmission requires correction? A. COVID-19 can be transmitted via droplets. B. Patients should be placed in negative pressure rooms. C. It spreads primarily through direct blood contact. D. Hand hygiene is critical in preventing spread. Answer: C. It spreads primarily through direct blood contact. Question 35. A COVID-19 patient is being discharged with home oxygen. What instruction is most important? A. Store the oxygen tank under your bed. B. You may smoke outside while on oxygen. C. Keep oxygen at least 10 feet from flames. D. Increase flow rate without calling provider. Answer: C. Keep oxygen at least 10 feet from flames. Question 36. A nurse notes a sudden drop in platelets in a COVID-19 patient on heparin. What condition should the nurse suspect? A. Acute renal failure. B. Pulmonary embolism. C. Heparin-induced thrombocytopenia. D. Disseminated intravascular coagulation. Answer: C. Heparin-induced thrombocytopenia. Question 37. What is the nurse's best response when a COVID-19 patient's family demands unrestricted visitation? A. Hospital policy requires all families to stay at home. B. You may visit if you bring your own PPE. C. We must follow infection control guidelines for everyone's safety. D. One visitor may stay in the room for extended periods. Answer: C. We must follow infection control guidelines for everyone's safety. Question 38. Which intervention helps reduce ventilator-associated pneumonia in a COVID-19 patient? A. Keep patient flat during feedings. B. Oral care with chlorhexidine. C. Limit suctioning to once per shift. D. Use only humidified oxygen. Answer: B. Oral care with chlorhexidine. Question 39. Which action is appropriate during specimen collection for COVID-19 testing? A. Wear surgical gloves only. B. Collect sample before donning full PPE. C. Label specimen container after leaving the room. D. Place sample in a biohazard bag inside the patient's room. Answer: D. Place sample in a biohazard bag inside the patient's room. Question 40. A patient asks if the COVID-19 vaccine can cause COVID. What is the correct nurse response? A. Yes, the vaccine has live virus. B. No, it cannot cause the disease itself. C. You may get a mild form of COVID. D. The vaccine can sometimes become active. Answer: B. No, it cannot cause the disease itself. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.